About 70 to 80% of all strokes are caused from the carotid bifurcation. That is, plaque forms at the bifurcation of the carotid artery where the one branch goes to your face, one branch goes to your brain. That plaque formation either closes the artery off completely, or the plaque formation breaks off little bits of cholesterol and plaque and platelets and fibrotic debris or thrombus, and it goes flying off up into the brain and gives you a stroke. The procedure we do to try and help prevent strokes is called a carotid endarterectomy. A carotid endarterectomy is a little bit like a rotor-rooter job where we go in and simply clean the plaque out of the artery. We do it through a small incision in the neck with the patient asleep, of course. When we get the bifurcation of the artery where it branches dissected free, we give heparin and a blood slickener called low molecular weight dextran, and all that's to help try and prevent a stroke. We also monitor the EEG, or electroencephalogram, which is the brain wave tracing. So when we put a clamp on the artery to clean it out, if the brain wave changes, then we put a little shunt to shunt the blood around where we're working. That's just to make it totally safe as possible. And then we open up the artery through the blockage, simply clean it out, clean all the debris and the hardening of the artery out. And then usually instead of closing it back primarily, we put a patch on it to make the artery just a little bit bigger in circumference, because the plaque, we know, reduces the risk of it ever blocking down again and reduces the risk of stroke surrounding the operation as well. The risk of stroke, if you have a 60 to 70% or greater blocked artery, is eventually 100%. The risk of stroke with carotid endarterectomy is about 1/2 of 1%. So we know we're taking a little bit of risk to do the endarterectomy surgery versus a lot of risk if we leave it alone. Usually the operation takes about an hour to do. I generally watch people in the intensive care overnight just to follow their blood pressure mainly, and then usually home the next day. And usually after about a week, the incision's healed up and you can go about your business doing whatever you want to after a week.